Attorney General Martha Coakley has received some criticism recently over her handling of the Partners Health deal and just this week the Brennan Group settlement over its lobbying contract with the Franciscan Hospital for Children. If you were governor, would you get involved in these deals and others that might not necessarily benefit the public?
Is that me?
Yes.
Okay. I think what I said about the deal that the Attorney General proposed with respect to partners is, having read it, I think it will be enormously difficult to enforce. Parts of it I'm not even sure I understand, and I've been in the healthcare business for a really long time. And I also think it's not going to get us what we want, which is a more competitive system. The deal I would have recommended would have been full transparency with respect to price for partners. Keep in mind that the same service provided to the same person with the same outcome at 4 different provider organizations right around here can vary in price by 300 or 400%. And the reason it can vary in price by so much is because nobody knows how much anything costs anywhere. We need full transparency in healthcare. I think this would be a great opportunity to start that conversation by requiring partners to post their prices. Second thing we need to do with respect to that transaction is we need to make sure that partners is not able to add 550 more dollars to their bill. That will destabilize a number of other providers around partners, most of whom are less expensive and in many cases just as effective. With respect to the Brennan decision, I just think that's another great example of one-party government. All those people know each other, they've known each other forever, they have relationships that go way back, and I think the fact that the Attorney General settled on that particular case on those terms is an outrage.
Mr. Fisher?
I tend to agree with much of what Charlie said, and it's too bad you didn't have a chance to say that last night at our 7th forum that you missed on healthcare with former Governor Dukakis. But in addressing the cost of healthcare, I use the example of car insurance. With car insurance, we opened up the borders. We allowed out-of-state insurers to come into the state and compete. And our car insurance premiums went down by about 13%. We need to do that with health insurance as well. Secondly, again, using the same analogy with car insurance, we use car insurance for catastrophic types of things, collisions or theft, but we don't use it for routine expenses of gas, oil, wiper blades, tune-ups, tires, things like that. We choose where to go for that, and that's what keeps those kind of prices of those things lower. So, for example, even under Obamacare, the Affordable Care Act, there is an option for catastrophic coverage. It's usually used by younger people, but the premiums are much lower. The savings from that go into the patient's pocket. I would want them then to choose routine care. They can choose where to go for their routine tests, what doctor, what medical facility, and that competition, that free market source, will drive prices lower and keep them lower. That's how I think we need to address the issue of cost containment within the healthcare industry.
But just simply yes or no to both of you. I mean, if a governor thinks that a constitutional officer has done something that is against the best interests of the people of Massachusetts, what recourse does a governor have to step in and say that's right or or wrong? I mean, that's what basically the question comes down to.
Well, in the case of the partners deal, as governor, the governor can submit a brief to the judge who's currently reviewing whether or not the settlement is in fact in the public interest, and that's what I think. That's where I think the opportunity rests there. With respect to the Brennan decision, I think the governor can call on others to conduct an investigation. I saw this morning that the Secretary of State is going to, which is sort of the appropriate. He oversees lobbyists and lobbying activities. The governor can certainly call on the Secretary of State to engage in an investigation, which the Secretary of State has.
Jim, so the Attorney General's office is an elected official. If she's done something illegal, then I agree exactly with what Charlie would propose. However, your question was, what if it's not something in the best interests of the citizens of the Commonwealth? Well, she's an elected official. That position is an elected office. We can use the bully pulpit of the governor's office and point these things out. Then it's up to the people who elect that person to say, is this the right thing? Is it in the best interest of us or not? And they have the final choice on that decision.
Thank you.
could park here for the debate?
Sure. I assume the press?
Yes, CR News. I'm a shoestring operation, but no, I won't CR News.
Okay. I think we're all filled up in here.
There was a spot over there.
Yeah, but obviously the cones are there. They're reserved.
What
We
about
don't
that
have any
spot on
open
the
ones.
end there?
That would be the president's spot, so that one's always coned off.
Isn't he in Martha's Vineyard? Oh, the other president, the college
president,
yeah. I'm joking. All right, so what do I do?
That's a good question. Hang on, let me grab.
I got
hang on
20
one sec.
minutes. I'll hang.
Just follow her.
Okay, great. Thank you very much. Thank you.
Very, very good.